Now, for our second big focus on the show today, something that has been spoken about earlier but remains a big worry, the long-term impact of COVID that it has on your heart, even in younger patients, even in patients who may have not had a very serious illness. The damage by COVID to the heart can be both direct and indirect. One of the major complaints has been inflammation of the heart or myocarditis. A US study recently found using MRI that cardiac abnormalities in 78 of 100 patients who had recently recovered from COVID, including 12 of 18 asymptomatic patients. Well, to talk more about this, we're now joined by Dr. Ashok Seth, Chairman Fortis Escorts Heart Institute. Thank you so much, Dr. Seth, for joining us. And this is very worrying. Also, the fact that it's affecting young people as well, and even those who've had mild illnesses need to watch out for any sort of impact COVID has had on their heart.
Yes, you're absolutely right. In fact, very early on in the COVID start of the COVID pandemic, reports from Italy had already warned us that heart problems could be a very major factor leading to death of many patients. And in fact, I even wrote up a piece in the National Daily saying COVID is not just a lung disease, it's also a heart disease. This was nearly 6 months ago. Now, what we've realized is that while COVID can affect heart patients in three manners, it's not just the serious patients who are very sick with COVID-19 who get heart problems. We know that in those, nearly 40% of the patients would get heart problems, and it is the cause of death in 40% of the COVID deaths. But what is important to understand is that even those recovering at home, those who had mild illnesses, those who said, "Arey, mujhe to pata bhi nahi chala, I had COVID, I just had a bit of flu-like symptoms, and now I'm fine and well."
Yes.
Even those can actually get affected by heart ailments. And there are three types of heart disease that anybody can present with. One is that COVID itself leads to increase in blood clotting. An increase in blood clotting can lead directly to heart attacks, can also lead to lung, what we call pulmonary embolism, can also lead to brain strokes. The second aspect, which you just said yourself, is the inflammation of the heart muscle as a result of infection with COVID. And that has a longer term, should we say, disease process. In fact, you yourself mentioned a study where nearly 70% of the patients who recovered from even mild COVID were found to have inflammations on an MRI scan. I just want to warn people that it's not to worry about. It is inflammation which has been seen in the heart muscle, which may not have any sequelae or may on the long term at 6 months and 9 months, and that still needs to be studied. But what we definitely tell patients is that after recovery from COVID, don't be careless out there. ये सोचो कि मैं recover कर गया हूँ, अब मैं तो बिल्कुल freedom हो गई है, मैं कुछ भी कर सकता हूँ. And many people I've known get back to even jogging and running within a month of COVID, saying मैं तो पहले jog करता था, अब मैं ठीक हो गया, let me go for a jog, or heavy weightlifting. Do not ignore your symptoms. If there's breathlessness, if there's palpitations, it is important to actually see a doctor. And for all COVID patients who have the facilities to have a checkup, we always do an echocardiogram and an ECG to make sure that those two important parameters of the heart are functioning safely. Thirdly, we always say that do not exercise heavily. Get back to a steady, moderate level of exercise even after recovery from even mild COVID. And just continue to, over a period of 2 to 3 months, to gradually build it up. And by 3 months, yes, you are in a safer zone to be fine, provided you have a cardiac checkup. So it's important to understand, it is not that every patient who has COVID starts worrying that my heart is going to fail, my heart is inflamed, and then I'm going to actually be a serious heart patient in 6 months' time. No, it is not something that you have to be scared about, but it is something that you need to know and understand so that you're warned about it and you're able to have a checkup for the specific reasons which I have said.
Right. In fact, Dr. Seth, I was going to ask you that as someone who also had a very mild COVID illness a month ago. I was going to ask you, when does one return to exercise and, working out? Because that's, again, you read about athletes who, think they're fine and go on runs and collapse. So it's something that's very worrying.
Yes, there have been reports of death on heavy exercise. It causes this inflammation, can cause heart rhythm to go haywire, and that is the cause of death, or a clot develops and that's the cause of death. In fact, we often recommend that patients, many patients get treated with heparin for preventing clots, we actually often recommend that most of our patients who are elderly or are heart patients always stay on aspirin for a much longer duration after recovery from COVID for up to a period of 2 to 3 months, so that they are protected from both the clotting effects as well as any unfortunate incidents which can happen.
And the good news, as you said, is that it will probably get all right in perhaps
Yes.
6 to 8 months.
I think that's the very important aspect, that nobody has actually demonstrated that inflammation leads to longest term sequelae, which we talk about 6 to 10 months. And perhaps the data is going to come out for that. So
Sure.
we have to understand inflammation can lead to acute problems. There's a speculation that it may lead to long-term problems, but the long-term problems have not been noted yet. And let's hope that there would be no long-term problems if we take full care of ourselves and don't overdo and overstress and overexercise soon after recovery from COVID, and have regular checkups from a cardiologist to make sure that we are progressing well.
All right, very important points for those who've recovered, especially if you feel that you've just had a mild illness and you're feeling fine. You have to be alert and take care. Thank you so much, Dr. Seth, for speaking to us about this.